Alright, so this video is going to go over digestive disorders and how they're diagnosed. And then we'll also be talking about how a urologist investigates and diagnoses the hematuria. Dang, that was bad. Okay. Alright, so if you're going into the physician's office, they're going to like check for symptoms. So there's going to be like pain and fullness or like bloating in your like stomach area, nausea, vomiting, maybe heartburn. Some like not so good things to look for are like dysphagia, melena, family history of like cancer. Anemia is something we should look for, and also weight loss. And also like how like the person's living is something they look into, whether they smoke or have like a ton of stress, alcohol. So then you can run a couple tests. So for anemia, you'll do the CBC, or the complete blood. So you look at the blood, the complete blood count, and see if you can find like an ulcer. And then you'll look at the electrolytes, because if there's like imbalance in the electrolytes, it would be vomiting. And then you can look at the liver functions. Also, like gallstones and hepatitis. And then, let's see. So for the H. pylori testing, there's the urea breath test. It's more preferred. And then you can also like look at the stool as well. You can use an ultrasound for imaging the stomach or the abdomen, or use the CT scan. So let's see. And then we'll go down to how a urologist would investigate and diagnose the hematuria. And so that would be done so it's either microscopic or gross. So microscopic, you'd have to use urinalysis to be able to detect this. And if it's gross, you can actually like see it visibly, like you can actually see the blood in the urine. So when you're like kind of like diagnosing it, you can also look at like some symptoms. So like pain, maybe like a clogged passage. Sounds bad, but let's see. It can also be associated with like infections or different medications. And then also you want to look at their history, smoking and stuff. Let's see, what are we on now? You can test with the urinalysis, obviously. It just confirms the presence of like the red blood cells. Let's see. It also looks for like white blood cells and nitrates. That would suggest an infection. And like also stones as well. You can also take a sample of the urine to look for like a UTI, the urinary tract infection. And then you can also, let's see, you can also do imaging, which would you could use the cystoscopy as the direct visualization of the bladder and the urethra. And that's like some stuff you can look for in this as well.